Okay, so that's noon, so we'll start. Hi, everyone. I'm Dr. Helen Serrano. I'm one of the editors here at BMJ. I'm one of the co-editor-in-chiefs of BMJ Innovations and work on BMJ Future Health as well. I'm really delighted to be hosting this webinar, which is a question that is coming up all the time, all over the place, and it's got a lot of issues associated with it that I think our excellent panel will get to as we go through. So we're calling this webinar Making Innovation Your Specialty, how NHS staff can pursue a career in digital health. And we know that this is a live question. So the way we're gonna run this is we're gonna have 3 quick talks, 10 minutes each from each of our speakers. And then we're going to take your questions. And the way we're going to handle questions for this webinar is by taking written questions in either the chat box or the Q&A box. I'll be monitoring them. And then when all 3 panelists have finished speaking, we'll put the questions I'll put the questions to the panel. So as we go along, please do use that chat box and the Q&A box, either whichever's easiest, and I'll keep an eye on those. So we won't be opening people's mics or anything like that. It'll just be me and the panelists speaking, just to make that clear. Really delighted to have these people with us. These are people who have, in one way or another, made innovation their specialty, and we'll be hearing some really quite personal stories of what they've been through to be where they are today, and hopefully you'll find it really inspiring. So Olivia, you're first up. Olivia Burns is founder of Hypoplas and an innovation consultant, and so I'm going to hand over now to Olivia to give us a quick run through of what she's up to and how she's got there. So Olivia, over to you.
Right, right, I'll just share. This is what I want to share. Okay, can everyone see that screen? Is that clear?
Yeah, perfect.
Yeah. Okay, so I had an interesting journey into healthcare. I was actually a patient, first of all. So I was born with hypoplastic left heart syndrome, which is a very rare congenital heart condition. And I was one of the first patients in the NHS to undergo the modified Norwood, which was a very new surgical technique when I was born. In total, I had 3 open heart surgeries, and I had an extra 18 other procedures on top of this to basically reconstruct my heart and circumnavigate my circulation. It has been, it was a very painful and traumatic experience, but it's been one of the honors of my life to have been a part of such a breakthrough in medical science and surgical intervention. And there are children born with this condition all around the world who are now surviving it healthily into adulthood because of those, early people who took the risk and underwent the surgery like myself. So that was my patient journey, but also that's what really inspired me around innovation. And now I've been asked to come back into the HLHS community and work on the next front of my condition, which is actually genetics. So now we're moving into genetic intervention for the condition, which is a really exciting journey to be a part of as well. Then I decided to set up my company Hypoplas, and I designed a more dignified, sustainable and cost-effective hospital gown. I was awarded Innovate UK funding to develop the gown and to patent the technology. I became one of the first patient cohorts to go onto the NHS Clinical Entrepreneur Programme. We won the MediLink Business Award, One to Watch. We won the UK finals of the Thai Global Summit of the women's pitching competition. So I had the opportunity to go out to India and to pitch for my business on the global stage, which was another amazing opportunity. And I still work very closely with NHS trusts about how we integrate this gown onto wards moving forward. I then decided to go back to university. So I got a place on the UCL MBA for Health at the Global Business School for Health. And because of the work that I'd been doing in healthcare, I achieved the Future Leaders Scholarship to go and study here. And then after finishing up my studies there, I decided to move into consultancy and use the work I'd been doing within healthcare on my MBA, within my own business, to become an independent consultant. So I thought on the next page, I would maybe share some of the projects I've been working on and share some of my insights that might, you know, help you with developing the tech that you are to integrate into the NHS and how to put it into a complex system like the NHS. So first one, I'm currently working with a health tech startup, and they are working on patient communication. I'm not allowed to disclose too many details as I'm in a very strict NDA with them. But one thing that I really worked on was the messaging with them and how to create effective communication on that piece of software that communicates well with clinicians, payers, and with patients. Because I think what's happening is people are developing a lot of software, a lot of apps, but they're not including the stakeholders within, you know, that journey. And then that means that that app or that software doesn't get optimized fully or used by the users that it's targeted at, because nobody actually asks the end users to come on board with the, you know, designing of it. And it's creating, you know, there's a lot of apps and software that are just not becoming very commercially viable because no one's asking the end users, you know, is this actually something you want to use? So I think moving forward, especially as patients are turning into more of a consumer role, as they take, you know, more power over their healthcare journey, it would be a very smart decision for startups and especially clinicians looking to move into innovation to have close contact with your patients whilst you are developing whatever piece of technology you are developing, to make sure that when you do launch the app, it actually does work for your end users. Another project, I worked in collaboration with GBSH and with the company Proximi, and we put together a consultancy package for an expansion into Saudi Arabia. And this was one instant that we had to really focus on product market fit and where in the world geographically on that expansion would Proximi fit into, you know, where would they be more commercially successful? We chose Saudi Arabia because they're really at the forefront of technology within the operating theatre. They want to be the country that is, you know, the first to be using robotics in really complex surgeries, and they're already doing that. And they're, you know, they're being the first, especially in children's surgery, to bringing in these, you know, life-changing innovations for patients. So one thing that you should, you know, we always say how to bring innovation into the NHS. Sometimes it's also good to look at markets outside of the NHS where you can generate, you know, real life data, because sometimes it can be difficult to get a feasibility study in the NHS. And so when you are looking to expand into other markets, or when you're even looking to go into the NHS, make sure that there is a need and you are serving a pain point within the system somewhere, and that it also fits in with cultures and with geographies. I had one company come to me. They specialize in geriatric medicine. They wanted to scale into the UAE. The UAE has a very small geriatric population, so they wouldn't get the scalability they need of users, but they hadn't considered that into their expansion plan. So if you're looking at expanding or getting into the market, you know, you really need to be doing those key market assessments. And then this was another project that we worked on with Siemens Healthineers. And this was about integrating the NHS imaging system and linking up the PAC systems from the CT scanners and MRI scanners to go into one kind of central cloud database in order to send images faster back to consultants and doctors. We had to work with a hugely complex system like the NHS, but then the piece of technology we were also delivering was hugely complex. So in order to put this together, you know, we had to put together a really well-structured implementation plan into a complex system. And in that implementation plan, we had to look at the resources that the NHS have, the resources that Siemens Healthineers has, how can you partner together to lean on each other's resources and to implement it effectively? And one thing that's happening with a lot of technology, which is unfortunate, is that when it comes to the implementation, there's just no, there's no strategizing, there's no thought behind it. And a lot of technologies get left behind because there's no realistic implementation plan in place. So when you're putting together your business case for the NHS and when you're taking it to procurement, I would always say go with your business case of what's the pain point in the NHS, what's the cost, what's the need for your technology, but also have a very realistic implementation plan that is broken down into very small chunks. And when the NHS sees that you bring a need, but also you have the resources to implement it successfully, then they are more likely to, take a chance on your technology and move it studies and things like that. And I've even had to do that in my own business, and talk about realistically, who do we need on board? What stakeholders do we need in the room to make sure that we get a feasibility study completed, but also to make sure that once that study is completed, can we move into procurement and can we get it procured through the right systems? So you need to be thinking of implementation before, alongside creating your innovation. And every implementation plan does go wrong. I would say that it's the nature of innovation. There will be bumps along the way, but as long as you can hit those key targets in time and that are necessary, then you will get there eventually. And implementation plans, give yourself a long lifetime span, especially when you're working with the NHS. Don't be too harsh if you can't get something completed within 12 months or 18 months. The NHS is a hugely complex system, and sometimes it does take 3 years, 5 years, 7 years, but you will eventually get there. So that is my advice to anybody that is starting in health tech, or innovating. That's my LinkedIn and email if anybody wants to contact me. And now I will stop sharing and pass on.
Brilliant. Thanks so much, Olivia. That's really a great sort of overview of some of the amazing things you've been up to and your background as well. So I'm delighted to welcome Dr. Xiaobin Liu, who's coming next. Sorry, Dr. Wu. Marina, I just want to check, are you ready to share Dr. Wu's slides? Yes, brilliant. So you'll have to say next slide, please, in CMO style, please, for Marina, but over to you. Thank you.
Yeah, thank you, Helen. Great. I really enjoy Olivia's talk. I'm going to talk to you about integration into image integration in NHS. I'm just working on it. It will be great to have you experience. Fantastic. Yeah, I just briefly introduce myself. I'm a consultant, histopathologist, working in NHS for more than 20 years now. And then 5 years ago, start my clinical entrepreneur journey. So now I have multiple headed, not just as a clinicians, and also develop a product, doing business, and have roles in managerial as a clinical lead for genomics. So, when we do that, that's the change maker. You need to make change in NHS, and all complicated, but really exciting. Next, please. So my journey of innovation really starts from the problems we are facing every day. I remember very clearly about 5 years ago, and there's a case of colorectal cancer come back from outsourcing cases already 5 weeks. That's really feel sad and unsatisfied for our own role as a histopathologist. So I'm searching for solutions. At time, I was in one of the leadership program in Suffolk, run by Judy Oliver. And in that program, Tony Young gave a talk and specifically mentioned about heart flow. Probably some of you working in NHS will know that, and it's quite widely implemented. And with that heart flow, which introduced by Tony from America, and we significantly have reduced the backlogs for patient waiting for endocardiogram. I'm really inspired by this example. I think, can I do anything? Find some technology works, reduce the delayed cancer diagnosis. So that's all started, and then I applied NHS Clinical Entrepreneur Programme. Luckily, I was getting the year after. Next, please. So joining the NHS Entrepreneur Programme is really the best things happen to any entrepreneurs who get into the innovation journey. And you like join a family. This family, I remember the first pitch stops I getting in, and you suddenly feel the passion, and the people really keen, want to get the innovation, want to make change in everyday life for the patient and for the community. And then this program is not just for the passions, and also give you guidance and knowledge and skills you need for develop a product, for innovation, and how to navigate all the complicated NHS systems and innovation system and industry and academia as well. At the same time, with each pitch stock, which is 10 per year, you have a founder stories, and the people like us, entrepreneurs, give you a story really moving, and also tell you what they learned, how to moving forward, and with industry leaders, including NHS leaders and academia. And this, you join this program is not just for 1 year, it's for life. You can attend the pitch talk every time you want. Even now, after 3-5 years, I still attend 1 or 2 per year. And also the resource always open for everybody. That's just fantastic. Yeah, next, please. With the Clinical Entrepreneur Programme, the help and guidance, we set up this CPRI Cancer Priority startup about 2.5 years ago, and we start to develop the first product is Recolon. Recolon basically is the AI triage diagnostic tool for colorectal biopsies, as you know, and we have delayed cancer diagnosis, especially in colorectal biopsies. The reason for that is colorectal biopsy is one of the largest volume in our biopsy histopathology service. And because with significant proportion of colorectal biopsy is normal, so often is the colon biopsy together with skin actually send out for ultrasound. So in that case is not, I cannot say often, you do see more than other specialties, and colorectal cancer is missed. In my professional careers, I think I see several, probably, not just the first one. After that, in different trusts, I see the same thing happens. So that's why we concentrate on colon biopsy to develop this first product. One thing I really like to emphasize, and innovation entrepreneur journey is not a single individuals, it's a team game. You need a lot of support, you need collaborations as what the skills, the knowledge you need, just not one person can accomplish. And one thing is really important, working with a patient and with charities that give you the aim, what you want to achieve. And the first time when talking with the founder of Right Child's Day charity, and Paul is also the survivor of colorectal cancer, I feel with my heart what the patient need. They need hope. They not just need diagnosis, they need hope. And in short term, how to manage their condition, and long term, what hope we can give them for the patient, for the family, for the community, and the world. Another thing very important is you need your team, the co-founder, like you need marry somebody, you need somebody really can work with you, share your vision and passion. And there's many regional and national innovation ecosystem actually there. You're looking for them, they are looking for you to help you as well. and navigate how to get a public and private funding system also important to make this journey successful. Next, please. And just a little bit more about this product, Ricola. Basically, it is the biopsy through this AI image analysis system. We triage them into different categories from malignant to normal. And for malignant cases, can be prioritized for pathologist diagnosis. And for normal cases, we're aiming to develop automatic reporting as the normal cases or reporting same will save time and also save outsourcing financial pressure for the trust as well. In this way, the turnaround time will significantly reduce, and we will eliminate all the delayed cancer diagnosis. Next, please. I think in this journey, it is two things really stand out. It's challenges and opportunities. For challenges, mainly is you become so busy. You have multiple tasks, multiple things you need to do in two different perspectives. One perspective, you're still working in NHS, and you probably have a managerial roles in NHS. At the same time, you start your entrepreneur journey. That's the second perspective. With entrepreneur innovation as a startup, and you are chief executive, your financial directors, your medical personnel, your personnels, and you also your own secretaries. You do everything. You really have multiple hats on you to do. And the time you can get really busy. You just see 10, 20 things you need to do at one time, which one you need to do. That's really challenging. You need to overcome. And at the same time, when you open this door, not just confine yourself with health service, with NHS, you work, what you do as an assistant, and you suddenly see the world in very different perspective. You can see so many different opportunities. You can continue to do your work, do entrepreneur, as an entrepreneur as well, and you can go to totally entrepreneurship, and doing business, developing your own product, or join other ventures to do slightly different things. And these pharmaceutical companies, so exciting. I think you will hear more. That's all open for you. Next, please. So these are a few things I really like to mention in this journey. It's so important to make yourself happy, healthy, and successful. And the first thing is about yourself. It's very important you make yourself physically fit and mentally strong. Why I say that? Because what you do with entrepreneurship, probably as a medical profession, we're not used to it. You have a lot of failures. And you really can stand up, be tough with all the failure. Don't treat failure to failure, treat as setbacks. And then I put Cassie's photo here. And she's my coach. Actually is also introduced from Clinical Entrepreneur Programme. She coached me 6 sessions. In these 6 sessions, I really feel transformed. She teach me self-leadership and self-discovery as well. In this process, you really know discover what is innovation, what is entrepreneur. You discover yourself, what you really passionate is, what you want to achieve for your life, and how you see yourself in this world. It is fantastic, really satisfying to see that and make your life more meaningful. And I mentioned that you have multiple heads is really busy. I think mindfulness is so important. And you do one thing, you wholeheartedly, 100% concentrate on this. And then when you finish that, you do next thing. So what I feel is, before and after coaching with Cassie, before I have 20, 30, hundreds of tasks in my head, all mixed together. But after that, the tasks haven't reduced. They are in a compartment, and you know how to handle it. You know what is priority, how to do it. And then also you treat yourself properly, physically, mentally. That's fantastic. I do hope everybody go that journey, have mentors, have a coach, if not all along a period of time. It's very important. And this is spiral up ways. And you will get stressed, you have cold, you get better, and next step, you go to busy again. So it's really important to have coach. Next, please. Another thing is we are medical professions. We're very happy what we are doing. We're confident we're doing. But when you're on this journey, you will find learning and discovering what you don't know is so important. So really have to be humble, have to listen not just with your ears, with your heart too, and to thinking how to going forward. I think the book I read last few years on this journey, more than all the 20 years after I qualified as consultant. Next, please. I'd like to really emphasize the collaboration of networking. I think entrepreneurship, like I mentioned before, is a teamwork. Want to make success, you really need collaborate widely. And like a jigsaw puzzle, you probably hold 1, 2, or 3, but all others holding by other people, by other organizations. Only we work together, we can make the perfect jigsaw puzzle. I mentioned books, webinars, YouTube is all your resource. Is fantastic. Next, please. And I always like to mention my family is really important for me. I think for any one of us want to be happy, fulfilled in life. And this is my husband. He is a co-founder, also CEO of CPRI. He's not just give me the family support, he also gives strategic guidance in this company. He has the entrepreneur experience before, and he also code the AI models for Ricolang as well. So it's so important working with him. And at the same time, and I think we must remember we need support our family as well. So in the Easter holidays, we take our grandsons out and we go different places. So it's very important supporting our children, and they're there to supporting us as well. Next, please. And this is the final slide. What I want to say is NHS need you to innovate. I like this quote. This is from a marketing guru, and he's really famous of marketing. And he said, no organization ever created an innovation. It's people innovate, not company. I think every one of you will make the difference. That's the most important. Your experience in NHS is really precious, really precious. And the world is open for us, is the opportunity, is great opportunity for us. Yeah, thank you. Yeah, so my contact. Yeah.
Brilliant. Thank you so much, Dr. Wu. Really appreciate some really great words of wisdom there. Let's move quickly on to Azim, if you're ready for us, Azim. And you have your slides ready. Azim, Dr. Azim Alam is a specialist registrar in clinical radiology and co-founder of the medical education platform Byte Medicine, which I'm sure he'll talk about a bit. But over to you for now. Thanks so much.
Thank you, Helen. Hopefully everyone can see my slides. If not, someone wave at me. But yeah, thank you, Xiaobin, and to Olivia as well for some really great presentations. I'm going to try and keep this to 10 minutes. A little bit of a preface behind these few slides I'm going to run through is that I'm typically British in my mentality and that I hate talking about myself. But I've had well, people tell me anyway, I've had a little bit of a weird career thus far. So unfortunately for these slides, I will be having to talk about myself. I find anyway that I learn the most when I hear stories about other people's journeys. So once again, my preface is that this is not me. Hopefully it doesn't come across like this anyway, kind of bragging about achievements, but more kind of trying to show you a journey that I've been on, full of like existential crises and numerous moments of like significant uncertainty about what I'm doing with my career. I'm taking a slightly different approach to the previous speakers in terms of, I've not built my own big digital health product or, gone through the tendering process within the NHS, etc. But I built an edtech company and I've worked with other big health tech companies. So I'll dive in anyway and whiz through these. So a bit about what I'm up to now. As Helen said, I'm a radiology registrar by background, less than full-time. I co-founded a company called Byte World around 4 years ago now, which is broadly speaking within the ed tech space with an overlap into health tech now a little bit. This comprises of Byte Medicine, which is an online education technology platform, essentially training medical students, particularly throughout Europe, to help them pass their exams. We've got Byte Labs, which is kind of health tech training and pharma training to help clinicians get roles within the health tech space and within the pharmaceutical industry. So that's Byte Labs and Byte Pharma. And then Byte Pacers is our work that we do with guys in St. Thomas's Hospital and Bart's Hospital in terms of helping postgraduate doctors pass their postgraduate medical examinations. As well as that, I got involved in the venture space. So I'm a venture partner at eWar. We're essentially an accelerator. We've just closed £60 million round in terms of helping early stage founders, not just within health tech, but more ubiquitously across other areas such as climate tech, prop tech, etc., helping them scale their companies. And then a few other bits and pieces in terms of advisory work that I do now, my ongoing work in academia at Imperial, and some, digital health other bits essentially, which I won't go into too much detail about unless people have questions about it. So that's a bit about what I'm up to now anyway, alongside my clinical work. So I alluded to this kind of at the start in terms of what I thought my career would look like and what it's ended up being like. I think I've fallen into the classic traps that people do fall into in terms of comparing yourself to others who seem to have it all figured out, and go down the kind of the stepwise yellow brick road progression that you'd expect within the medical profession. And I guess I've never ascribed to that, somewhat unintentionally at the start and now a little bit more intentionally. So I'll touch on a bit about my journey in terms of founding a tech company. So Byte World, or our first product, Byte Medicine anyway, was called Oski Bytes initially. This was back in kind of 2020-ish. For those of you who aren't doctors by background, particularly for context, the Oski examination is a undergraduate medical examination, which is essentially a type of exam where you go around a circuit examining patients, taking histories to help you get through medical school. So we thought we'd kind of build a company with a very low barrier to entry, and the only skill set we really knew outside of clinical medicine, which was building an education company. So we took a very hacky approach in that we had no real seed money. We had just a little bit of money that we were making in our foundation years to funnel into this. And we convinced as many consultants at Guys and Tommies as we possibly could, which is where me and a friend of mine were working, to contribute to this this textbook that we were creating, essentially. And we said, look, we can't pay you because we can't make any money from this, but and we don't have any money to really put into this project, but you'll put your name on this. We're going to try and get it published, etc. And we did. We put together our first textbook, put together a quick website. We were running events in slightly questionable hotel basements with not great air conditioning and things, but that was all that we could afford to try and get some money in this kind of early stage entrepreneurial journey and see whether we could build something cool. So this photos on the right is kind of all the bubble wrap that we were manually putting together to try and wrap these textbooks, going to the post office. And then obviously people were reporting big errors in this textbook, as you can imagine, because we were putting them together. We'd finish our shifts as doctors at kind of 5-6 p.m. We'd often work all night in the library trying to write this textbook together. And like, this is an example, asking the patient to stand with both legs held out in front of them, which was one of my favorite typos in this textbook. But anyway, this was kind of the first taste of entrepreneurship in inverted commas. I then took a little bit of time out of medicine after F2 because I wanted to try something a bit different. So I moved to LA to work in the music industry. So I signed a publishing deal and worked as a songwriter out there because that was something I always wanted to do. So I was working with Atlantic Records, lived there for a year, worked with some really great artists, and had loads of fun. So went to the Grammys, went to the Emmys, and that photo on the left there is with Drake's dad. So I performed with him, which was very strange, but good fun. And unfortunately, I had to come back because of COVID more than anything else. So my plan was to spend a few years out there, but was whisked away from LA as soon as the pandemic hit. So then the question was, what do I do with my life at this point? And I wanted to try and take some of the entrepreneurial stuff that I'd been doing, of like trying to build a very early stage company and try and fill a gap within the edtech space at the time. And what we did is I brought together a few friends of mine, one that was a developer, one that was a designer, and a couple of clinicians, and said, let's try and just build an online platform that is a little bit more scalable, but also just run webinars every single day for as long as we possibly can when university or med schools were closed. I'm sure you remember this period of like proper full-on lockdown. Everyone was at home except for the key workers. But, particularly from our point of view, medical students and nursing students and, any kind of clinical specialty in terms of those students were struggling because their exams were cancelled. Things weren't really optimized for online learning. And we ran webinars every single day, almost every single day for about a year and a half. And these were on how do you manage acute coronary syndrome? What is bowel obstruction? And literally everything in between. And essentially, this was once again a very hacky approach of just running Zoom webinars to see whether people would enjoy being taught online during the pandemic. And we started a wait list, and what we found is, these were not revolutionary webinars of any kind, but people wanted to feel part of a community. And it started off with 100 people attending, then 200, then 500, then 1,000. And we weren't charging for any of this. So we had to keep, paying more for our Zoom subscription, because at certain points there were about 2,000-3,000 people trying to attend each webinar from all over the world, from Madagascar, from Singapore, the UK, the US, etc., and people feeling part of this community basically just on Zoom. So that was really great fun. And then we built the platform alongside it as well. During those kind of 2.5 years of proper full-on COVID, we taught around 200,000 students across 100 countries, 20 million minutes of watch time. But once again, very, very hacky in our approach of just trying to train and teach as many people as we possibly could. We got a bunch of cool achievements, which once again are not mine per se. They are the co-founders and the business's achievements. I couldn't have done any of this without them. But within a couple of years, it took us from kind of essentially building these very poor quality textbooks and running these poor events to, the king has kindly been very kind to us and going to his coronation and going to meet very cool, incredible people, and the Queen honoring us, the late Her Majesty. And once again, like very interesting journeys that I never expected to go on from my journey outside of clinical medicine during this period. I'm very serendipitous, but very much not of my own doing, and being in the right place at the right time and having a great team alongside me. So the next question, I guess, is how does all of this relate to health tech? What I did is I tried to then take a little bit of time away from the business to see how could I leverage my clinical background, my academic background, and also building a startup essentially. And through a friend of a friend, I was introduced to a mentor of mine now, incredible ex-doctor called Ben, who's the founder of a platform called Serrano. Now, for those of you who don't know Serrano, it is exactly what it says on the tin. It's a digital health platform, and it all was founded when Ben, who you can see on the bottom right there, his mother fell down the stairs, unfortunately, a few years ago, and he found it really difficult to arrange care for her at home. So he said, what is the best way to do this, and how can we use data to try and allow people to arrange care for their loved ones at home to avoid them from being moved into a care home, essentially? And he founded Serrano, and the aim was to try and make that process more seamless for loved ones looking after their family members at home. And the aim was, first of all, to improve that process. And then second of all, how can you leverage a huge amount of data to prevent these elderly people being cared for at home from then being hospitalized? Because as you know, you then get institutionalized and you decondition, etc. So that's what Ben did. And he's now become one of the largest care providers in the UK and raised around £500 million of funding. And I was brought on as a clinician to work within data and product over there. If people are interested as to what I got up to over there, more than happy to answer that in the questions later on, but I'm a bit wary of time. But anyway, the algorithms that I helped to develop alongside the team now impact around 20 million care visits each month, preventing several thousand elderly people at home from being hospitalized each month. And it basically involved working alongside data scientists, designers, other clinicians, and more. And was really just a great experience of how do you work within a really fast, rapidly scaling digital health company. And as I said, can touch on more about that a little bit later on. Was one of the lead clinicians working on basically our 2 peer-reviewed publications that you can see here. And we're now due to save around £1 billion for the NHS by avoiding elderly people from being hospitalized from basically using carers as a surrogate to try and collect as much data as possible to predict when someone may be at risk of hospitalization. I'm going to whiz through some of these. Some of these are cliched. Some of these hopefully are helpful. This is probably the most cliched quote I have in here, but I think it's incredibly valuable. I couldn't have really done anything that I've managed to do so far without great friends and people around me supporting me on that journey. So be very non-British in your mentality of like putting yourself out there, going to events, meeting as many people as you possibly can. Learn through action in terms of don't just read as many books as you can, but try and be as proactive as you possibly can to actually think about what you can build and how you can actually impact within this space. If you are going through clinical training now, hopefully you've got some idea of what this looks like from my career, is that don't try and race to the end if you don't want to, right? Like take time to explore other interests that you may have, and you don't need to follow the crowd. You're allowed to have multiple passions and interests, and don't let anyone pigeonhole you or tell you otherwise. Go less than full time, take years out of training if that's what you want to do as well. And take, kind of similar to what Xiaobin was talking about, take time to reflect, get a mentor if you can, and really be as introspective as you can as to whether what you're doing is what you want to be doing or not. I won't dwell on all of these, but I can share these slides at the end. And here are a few organizations that may be able to help you as well. I'm on the NHS Clinical Entrepreneur Programme. I found them very helpful. But as I said, I won't dwell too much on all of these because, once again, I will share all of these afterwards. And feel free to connect with me on LinkedIn or pop me an email if I can help. But yes, sorry that overran slightly, and hopefully that was helpful. Thank you.
Brilliant. Thank you so much, Azine. That was really interesting. So we've got 3 different interesting speakers who've all had slightly different paths, but some of the same messages, some of the same training and networking experiences. And I think what most of our audience are interested in really is sort of digging a bit deeper into those experiences that got you where you are. So got a question from Naila Nazi, who is a paediatrician in London and on the Clinical Entrepreneur Programme already. I wanted to ask, did any of the speakers do any postgraduate study postgraduate study in digital tech, health or AI before starting their startup? Or is this something you would recommend clinicians to do? And maybe a little bit from each of you on sort of that benefit of formal postgraduate study, and then maybe we'll talk in the next question a bit more about the sort of other networky type opportunities. But Olivia, should we come to you first, because you mentioned your MBA and that's a postgraduate studies.
Yeah, the reason I went back to study on my MBA was because I really wanted to understand the business of healthcare. I'd been a consumer of healthcare, I'd been a patient. I tried to get into healthcare and I couldn't understand what the barriers were to getting into healthcare. So I wanted to understand I wanted to learn more about the, healthcare system from a macro level. And I just wanted to understand what were the, what underpins the whole healthcare system. And, unfortunately, it is budgeting, it is money, and healthcare is a business at the end of the day. And on that MBA, I did learn a lot of health tech and AI and things like, applications and things like that, and how do we apply that to healthcare systems. So I think probably what I learned most from that was understanding how technology fits into our healthcare system, and like what is the appropriate technology that should be used, and what involvement should all stakeholders have to make sure that the technology we are implementing is equitable and is accessible to everybody who actually uses our healthcare system. That was a really poignant thing that I learned. So that's really how my postgrad helped me.
Great. Dr. Wu, postgraduate specifically in digital health and entrepreneur?
Yeah, I haven't done any myself, but I regret. And I think if you have time, have energy, you really should do it. One thing I think MBA is very important if you want to run your business. I have to say I learned from what my mistake and gradually get everything together. But if you have time, MBA is not cheaper too. I have resources. I think MBA definitely is shortcut. That's what I feel. Especially for medical profession, we like to follow the rules. So I think MBA is fantastic. And another thing is data science, informatics, digital technology. I think if we can study for some C's, master degrees, and it's a lot of available online virtual. I think it's fantastic. But I regret I haven't done any of this.
Interesting, thank you. Azim, are you postgraduately studied in anything specific in this area?
Yeah, the only postgraduate degree I did was a PG dip in education when I was going down the edtech route. I've never done any formal digital health training. I'm not technical by background at all. I think the key thing really is to think about why you want to get any formal training. Thankfully we're living in a world where there is a huge democratization of the knowledge that you need to learn to build a digital health company, whether that's regulatory compliance, even the more technical side of things. So I'd say really think about what the aim is. I'm considering going back to Imperial to do a PhD just because I really want to get really great at something specific, from a more technical side of things down the AI and ML route. I've not done an MBA. I have friends who have gone to UCL and done like the digital health and entrepreneurship, and they've ended up at Google Health or DeepMind, for example. So once again, have a think about why you want to do a degree. As Xiaobin said, these aren't expensive. MBAs are not expensive, are not cheap, but they, in my experience anyway, like being more hands-on and practically trying to gain experience yourself is once again like a hacky approach to try and avoid forking out a lot of money on an MBA. But if you can afford it and you have the time, then an MBA is an incredible couple of years usually experience.
Thanks. And I think the other question really is around all these other opportunities there are that aren't necessarily training, but have a bit of training, but a bit of networking, a bit of mentoring. We've talked a lot about the Clinical Entrepreneur Programme, and there are other things as well, aren't there? So maybe talking about what was the best thing you got from the Clinical Entrepreneur Programme, and if you've been involved in any other specific accelerators or anything like that. There's lots of different opportunities out there. Are there any particular ones you guys as speakers could recommend or wish you'd been on, or what you got out of them? Because there's a lot of choice for someone who doesn't understand. Let's go in reverse order. Azim, let's start with you and head back.
Yeah, sure. So yeah, I'm on the NHS Clinical Entrepreneur Programme. I'll be honest, I haven't engaged as much as I could have or should have in the process. I have friends who have, and I particularly gained from the two main things, which are the pit stops, where you actually learn from experts, and then the second thing is the kind of mentorship platform or process where you can literally find a mentor who can support you in your journey. I would say, having spoken to people, those are the two main benefits. I regret not exploring those more. I could still do so now, but I think the network that the program kind of gives you is probably one of the biggest benefits. Beyond that, once again, I've not gone down, the Digital Health London approach. I've not, really engaged in other accelerators. I have plenty of friends who have done like the FMLM approach, where they're getting more experience down the leadership and management and getting seconded to, Bupa, for example, and building digital health products. I know other people who have gone down other routes in terms of Digital Health London, where they're trying to build their own product and gain funding, etc. So once again, Clinical Entrepreneur Programme is the only one I've had any real experience with, but there are plenty out there to support clinicians who are trying to build.
Yeah, Dr. Wu.
Yeah. So I just slightly for me, when I get into Clinical Entrepreneur Programme, basically I have a passion and a problem I want to solve. So I know nothing about the business product development. So I really throw myself in. I won all 10 pitch stock for the first year. And what I learned a lot, basically you have big frame, you have frameworks, you know roughly what you want. But I think people from different levels, if you already have business, you will pick up different things. For me, I pick up really roughly which direction I need to go. And after that, and I also joined the Topo Digital Fellowship. That is fantastic, but slightly different directions. If you really passionate about entrepreneurship, that means you want to change your work within the NHS. That is very, very good. They very much target on the digital technology leaders and tell you internationally, these other people come to give a talk about what happened in Australia, and all this is very useful and information governance. I think that's the Topo Digital Fellowship. Another one is AI Academy. I think it's 2 years program. And that's fantastic, but because I think it is for the young people, trainees. That's brilliant program. They are also, I think, each year in target of different areas. For example, thinking radiology, histopathology important will target. And for other things, actually, nationally, there's programs. For example, now I'm working with Innovate UK business growth specialist. This specific help me with all aspects of the business. That's fantastic. You need to get certain stage, get funding, to get these accelerators, regional, national, and they're looking for somebody really have potential to help you. So I think from my experience, if you have time, join as many as you can, and you really gain. That's your network start. You really gain. Thank
Olivia.
you.
Yeah, I would say there are a lot of accelerators out there, and I think you need to be strategic about what you want from the accelerator. A lot of people are like, oh, I got onto this accelerator, this is amazing. No, you are the person that picks the accelerator. So when you are thinking of an accelerator, I always say, does it give you capital? So does it give you money to move the business forward? Is it going to give you education? Is it going to give you the learning that you're missing in your knowledge? And is it going to give you the network that could advance your business as well? Those are the three things that I would say when you're picking an accelerator. I would agree with Dr. Wu, is that Innovate UK, the growth hub, has been phenomenal for my business. I've been given grants that have pushed the development forward. They helped me with my IP strategy, things like that. And the NHS Entrepreneur Programme, that gave me a very big network, but also, I live and breathe entrepreneurship, and a lot of my friends around me are entrepreneurs. And it was very demoralizing to see all my friends around me scale their business or go after venture capital, but I wasn't growing at the rate that they were because I was moving with a slow system like the NHS. So when I went to the NHS Clinical Entrepreneur Programme, I was able to sit comfortably with other people and talk about the challenges that they were facing with innovation in the NHS and the barriers they were coming up against. And we were able to problem solve and bounce ideas off of each other because we were both working in the same system. So it was more like a tribe kind of thing, and you could talk about your problems and, take real comfort that you weren't behind or anything like that.
Great, thanks very much. There's lots of sort of questions and comments coming in, particularly around all about what helps and what doesn't help on getting into and getting ahead as an innovator. And this session's particularly about innovating in the NHS. I think one of your slides, Dr. Wu, was really interesting, is you don't know what you don't know. And I think one thing I'd be really interested to hear from each of the panelists is, what didn't you realize you didn't know that was really a key when you discovered it to unlocking what got you to the next stage or got you to the next job? I think there's a lot of, especially coming from a very pure clinical background, there's a lot of sort of you're assumed you know everything once you're a qualified doctor, right? And then and then especially if you branch out into something like business, then discovering the rest of the world is a big thing. So maybe Dr. Wu, seeing as this is one of your slides, I'll start with you on this. What's the main thing you didn't know you didn't know?
It's really interesting. I can tell you a story. With some clinical entrepreneur programs, I think each year we will have the NHS leaders have time to networking with them, talking with them. And I remember very clearly on the first year, I met Professor Stephen Paul. And I talked with him. I said, he's a pathologist. I'm developing something is really important, can really reduce the backlogs. I said, oh, that's fantastic. That's really needed. I said, when do you think you can finish it to in the practitioner? I said, 6 months. And then retrospectively, you're all going to laugh at me. You're developing an AI product. You're thinking you're going to use 6 months? I think if 6 years, probably is not exaggerate. I need to do 3, 5 years. So I don't know what I need to, not just technology, work on the slides. I need regulatories, how long you need to get the evidence, you need information governance and need clinical trial. So that I really don't know. I think around the medical device is many things, not just technology, not just the technology is useful, can be used, work, but it's many other issues around it. I think that's one of the things
Thank you.
learned over the years. Yeah.
So, Azim, is there something that you didn't know and then found out and thought, oh, I wish I'd realized that earlier?
Yeah, I think a lot of the ones, like I said before, I've not built a digital health company myself, but working as a clinician in a rapidly scaling health tech company, I think the big thing you go in with is significant imposter syndrome. Kind of, what do I know about trying to build digital health products and deploying them into the NHS at scale when I've worked most of my time on a ward or as a clinician? And I think what I had to really try and do is I essentially had to start to think, actually, what are the tangible transferable skills you learn as a clinician that do correlate quite well in the commercial world? And what I found myself as being the only clinician amongst like a couple of data scientists, a couple of developers, a UI UX person, and like a few other people as well. And you're essentially the subject matter expert. But what I found is that you're so much more than that. So the communication skills you learn at medical school are, what I found anyway, is working within that multidisciplinary team are invaluable in actually trying to break down really, really complex ideas and workflows that you're building into their substantive components, and then explaining those in very clear language to lots of people who don't really understand what the other person is really saying or trying to do. And I think we really underappreciate how great you have to be as a communicator to work as a clinician. And working in industry, I found that, I'm not saying other people aren't good at this, there are plenty of people who are, but we really undervalue that as a skill set, because you have, like, to even work in a multidisciplinary team clinically, and you're talking at a multidisciplinary team meeting, you have to break down things that are quite complicated for other clinicians. And that skill set is so valuable in industry, and like such an underrated skill to have as well. And that's just one skill. And there are plenty of others that are transferable. But I think a lot of people, if they're trying to work within big tech, don't really think about what are the things that I've learned at medical school or nursing school or whatever, wherever you've been, that are now transferable into industry. And there are a long list of those. And I wish I'd been a bit more confident in thinking like that earlier on.
Oh, that's great. Thank you. And Olivia, have you got any?
I mean, probably everything. I've never worked in the system. I came from a patient background. I knew what it was like to receive care, but never to give care, never to work in the system. I didn't understand how the NHS procuring, happened. I didn't understand kind of why there was a lack of communication with patient needs and things like that in the NHS. I didn't understand anything. I had to learn everything as I went. And I think, that's why some people are like, I'll start that thing when I'm ready, or when I know more about it, or when I know the right person, or I get into the right room. And it just doesn't work like that. You just have to keep building, keep learning, making mistakes, learn from your mistakes, and just keep going. And I wouldn't say there's one specific thing that I didn't know, because it was just like a whole journey of just absolutely learning and education the whole way. And, starting a business, you're just thrown into everything And like you say, you have to build on your communication skills, you have to build on your strategy, your business strategy, you know, funding, things like that, that you're not actually taught at school and you just learn on the job.
Brilliant.
So yeah.
I'm going to cut you off there because we're running out of time completely, but thank you so much for everyone. Marina, if you've got my slides at the end. And thanks so much to all our panelists. I've got some things to say which are about Future Health in November, 6th and 7th of November. The registration is now open for that. We've got more of these webinars coming up. If you wanted to give us a review of this webinar, but also Call for Problems is now live. That's a great way to get started. If you can see a problem, please submit it to our Call for Problems for Future Health. And we'll see what we can do and see if we can bring the right people together to help you sort it out. There's more of these webinars coming up. All of the webinars are available on YouTube afterwards, and if you want to access that, they're available on YouTube and on the BMJ Future Health website. So we don't issue the slides separately. A couple of people have asked, but the webinars are available for the next 6 months to view on demand. So do tell your friends if you enjoyed this or you thought there were any useful tips. And all of our speakers have, I think, shared their contact details and we'll be happy to be contacted for support. It's about who you know. You now know 3 excellent innovators. Do wish you all the best with your innovation journeys and hope to see you at a Future Health event in the future. Thanks very much.